Welcome to Reproductive Health Show, where we unravel and demystify crucial aspects of your reproductive health. We believe in breaking the silence on taboo topics and basically empowering you with knowledge and fostering open conversations. Welcome to today's show. And of course, joining me is, drum rolls, Caro, your health coach.
Yes.
How are you, Caro?
Very well.
Okay. I'll allow you to introduce yourself, but of course, next to you is a gentleman who we all know and respect in this field. We cannot talk about reproductive health and not have Dr. Kireki on set, surely. How are you, Doctor?
Niko salama.
Karibu sana.
Asante sana.
So let me allow Caro to briefly introduce herself. Briefly.
All right. Our viewer, my name is Caro, your health coach. I am the founder of a company called Rejuvenating Nature's Beam because I practice as a naturopathic health coach. Simply said is I'll help you and I and all of us to live a healthy lifestyle using the natural resources that we can. And so I'm so much in preventive medicine to help us live a healthy and full life.
Welcome to the show, Caro. Yeah, Daktari.
Asante sana. Thank you for inviting me to the studio. It's always a pleasure to come to the studio. As you said, our viewers, my name is Dr. Kireki Omanwa. I'm a consultant obstetrician and gynaecologist, and I teach at the University of Nairobi, Department of Obstetrics and Gynaecology. I'm a fertility specialist and also presently the president of the Kenya Obstetrical and Gynaecological Society, in short, KOGS. Yes.
Beautiful.
Yes.
Karibu sana.
Asante sana.
There's so much to talk about today, but of course, let me introduce the topic. We are speaking about low libido. Where do I pick this conversation from? First of all, we've not been having conversations that are candid enough to help our people be able to address the real challenges that they are facing, especially health-related challenges. The stigma has been just on the roof. Why so?
As a woman, when you're growing up, first of all, the society, because of our culture, maybe African culture, not all the African cultures, but some cultures, a girl is taught that, and never consciously, never directly. If you ask someone who ever taught you that, they'll never know who taught them, but they know that. They are taught that a woman who is able to express her sexual needs, her sexual desires, her sexual thoughts, she's promiscuous. The society and sometimes the culture makes the woman believe that sex for a woman is only for reproduction and only to please the man. And so when a woman is experiencing any issue, she's not able or she's not given a platform to talk about it. And when she talks about it, she looks like a very bold, crazy, out of this world woman. And so one is the culture. Two, it could be the societal beliefs. And number three, even as we talk about low libido in women, there are people, especially if you look at it in Swahili language, all the posters you see on the street saying nguvu za mwanaume, tunaponya nguvu za kiume. No one talks about nguvu za kike.
Yeah, and from a man's perspective, maybe we are too ignorant to even stop to imagine that women could be going through issues that don't allow them to, enjoy sex or even have the urge for it.
And we forget that for women, okay, for both of us, it's very biological. Sexual urges are very biological. And for a woman, the road is narrower and longer. What do I mean? The process for a woman to get the arousal, the experience and everything takes a bit longer as opposed to men, how they are created. You are created that you can even have an erection even without thinking about it. But for a woman, it's a whole process that maybe we'll have to break it down.
You're making it sound like we are just
Mechanical. Want an erection, you have it.
Ahead, the jogos and...
Yeah, it's so easy for a man, but for a woman, the difference is for a woman, it starts from the mind. No, it starts from the heart, then goes to the mind, then goes to the body. Unless if you do it as a business, it should be the other way around. And for men, the heart has nothing to do with it.
So how do we go to the mind? Now you said it starts from the
It's
heart.
the heart.
Okay.
Then the mind.
Then the mind.
Then the body,
Then the body.
responds to it. So our process is a bit different. And so even when we're talking about women, low libido in women, there are women who are watching us who don't even have an idea they're supposed to have a libido. Because, I was supposed to feel anything. Because they don't know. Because they do it for reproduction or to please the man, nothing else.
Yeah, and that also speaks to, even over time, you realize our cultures, as you say, especially growing up as from a young age, as a young girl growing up, because you don't have, those conversations around sex. Don't walk with those boys, don't do that. So you grow up believing that actually sex is something to run away from.
Yes. And unfortunately, even now religion has come in, and you're made to believe from the word go it's a sin when you are young and you're prepared for marriage. Then you go and do a very good wedding. When you get to the marriage, you still think it's a sin. So you approach it from the sin point. It's a forbidden thing for a woman. So every time it's happening, you don't even understand why. And then, of course, the fact that there are women who tell me that their husbands don't know how to prepare, so they do this.
Oh my.
Oh. So, and that's a signal that
yes, he's ready. He's ready. So he's like,
Hiya. Yeah.
no, he doesn't even talk. Then you are expected to just remember the process, which we will have to go through, the processes. Yes.
What are we subjecting our women to?
I think we have an issue. We have a serious problem. In some cultures, we're talking about cultures. In some cultures, is that actually girls are taught that this is something which is fundamental in the marriage. And actually, if she's not satisfied, I think we'll talk about that later on. If she's not satisfied, by meaning that she does not enjoy it, she doesn't have an orgasm, actually that is a ground for divorce. There's some society, I won't say which ones, but I know.
We need to visit them.
I know there are some. And there are some whereby they're actually taught to do some things which will actually increase the sensitivity of the vagina, such that when she's having intercourse, she will actually be able to enjoy it, and she does enjoy it. Now, I don't know whether Ukopia, I don't know.
Yeah,
but you see, when you talk about libido is basically that conscious or even an unconscious drive for sex. And it is something which is natural. It is a desire, just like food, just like water at a certain time. I mean, sex should be something which is physiological. All of us should be able to enjoy it. By enjoying it, it's not only for procreation. Procreation, yes, that is part of it. If we are going to do it for procreation, then we'll be behaving like animals, because animals are the ones which have a certain period when they are on heat. That is when they can only have sex for procreation. But having sex just to enjoy it, I think it is a realm of human beings. But then, as you said, we have taken it another way. Whether it's culturally, whether it is religiously, and other way, we have now brought it into that it is only for procreation. Now, when you talk about sex, it's a very complicated mechanism. For men, as you said, men can have an erection just like that. Even if it seems as if it's just like that, it's actually not just like that.
Well, that is also something else. Most women, if you ask us,
Yes.
we think it happens even when you guys are asleep, because that is what we were taught.
It does happen, by the way. It also does happen even when you're asleep. It does happen. But for women, it's a little bit more complicated, as you said. The process itself is an emotional thing. The environment has to be right. That person has to be somebody you feel comfortable with, in order for you to actually be able to have that urge, have that desire, and and it has to start sometime. And as we said, men are visual. Men will look and they say, that lady looks she looks nice. She attracts me in one way or another, whatever it is that attracts you in the physiognomy of the woman. But for the lady, it's different. The ladies are more, what am I hearing? That is why you see all these rhythm and blues, you know, those slow songs and whatever it is. And now we have Ohangla. You see Ohangla, guys? So when you tell her how beautiful she looks, you know, how nice she is, how important she is, you know, that is basically laying the groundwork later on. Like my wife says, it's like baking a cake. You don't just go in, you throw it in an oven, and that's it. Pole pole. It takes time for it to warm up, such that it gets the quality that you actually want. And when she told me that, I was like, Allah, okay.
But now they are putting a lot of work on our... So how do we help each other? Because now if on one hand,
yes,
within a minute,
yeah,
already I'm ready, and you want a whole day to bake and prepare the cake, surely. Where do we meet?
We meet at the point of helping each other understand.
Yes.
You know what Dr. is saying? Yes, we want to hear. But let me shock you. Even scientifically, or when you are touching us, yes, this part of the body has very many nerves, beautiful nerves for me as a woman. Have you ever thought why God put beards here for you guys? Have you ever thought about it?
Beards.
When your beards touch me here, it is a feeling that is out of this world. So God knew when he was putting your beards
every
here.
Day.
God knew. So any
Yes.
woman who is watching will tell you that even after you shave your beard and you go and touch with that roughness, because you see you are masculine, this part is very sensitive. So there's a reason why we want to hear. So start by hearing. And if I help you understand, you'll be able to do it. But most of us first of all, we don't even know what we want. So we don't know how to make you know what we want. And that is why we are having these conversations. Yes. And also we need to help you understand. Most men now, like I'm sure Dr. will, on any other episode, will help us understand the physiological of a woman, the different stages, adolescence, teenage, menopause, and all these things. Some men don't even understand that in a month, he's dealing with 4 different women in one woman. In a month, you meet 4 different women in the same woman. When she's ovulating, when she's on her period, when it's a different time, she's totally a different person. Yeah. So if a man is not helped to understand that, he will do this at the wrong time, and fights will come in. So we help each other understand how the process is.
Okay. So ideally, Dr. Kireki.
Yes.
What is the ideal libido status that a woman should be in?
It is a difficult one.
So that then we can find the threshold of low, normal, and if there's something like above normal.
That's a difficult question. But one of the questions that I ask in any consultation, after I've asked all the other questions, actually usually I leave it for last, because sometimes it feels a bit embarrassing for the patient and even for the husband. And I usually warn them in advance. I'm going to ask you a sensitive question. How often do you have intercourse? And usually when they're there with the husband, 99.9% of the times she will look at the husband. And I will tell them, I knew you were going to look at your husband. And then the man will take over, and then you say it's 4 times, and then the wife says, "Apana, mimi nakuwaga mara mbili." So sometimes it becomes a bit of a challenge. But that sort of gives you an idea about the sexual activity, about the libido of this couple. Maybe wengine wanasema once a week. Others say, most of the time it is 2-3 times a week. Now, you'll find the other ones who are very active. Wengine wanasema daily, except when you're having the periods. And usually these are the young couples. I mean, it is expected. It's a novel thing. Now you have this lady you've always admired, and now you have her. So you really want to, maximize, But
She's not going anywhere.
But you enjoy it. You have waited for it for so long.
This is my time.
This is the time. But then I've also been surprised by getting couples who have been married for 20 years and still having 3-4 times a week. You know, sometimes it is higher than even younger people. So it really varies. Now, you may find others who say, it's just once a month and I'm okay with that. That is a bit on the lower side. Once a week, it's a bit on the lower side. But by and large, 2 to 3 times a week, that is sort of average. But remember, libido depends on very many things. For example, if a patient tells you that he experiences pain during intercourse, and the pain can be because of anything. Pain can be because of endometriosis, for example. And if we suspect that a patient is having endometriosis, I hope this is something we can talk about later on in the future. One of the questions we ask them is the pain during deep penetration. And patients, get a bit jittery when you start asking about this, because you're talking about deep penetration. And these are things which are nobody's supposed to ask about them, but we ask about that. So if there is some sort of disease that can cause, a low libido in women, sometimes fibroids. A lot of women have fibroids, and if they are big, they can actually interfere with the sexual life. If they've had issues in the past, and then they have what you call vaginismus, meaning that when there is going to be penetration, the vagina contracts, and there is no way that man is going to penetrate. And usually you may find that these are patients who have had, incidents in the past. They've had, sexual molestation, rape, and so on. So that obviously will have an impact. And some of them have never healed from, such incidents. Diseases, for example, you have high blood pressure, you have diabetes, and diabetes, if it is there for quite some time, it will affect the blood. Remember, for a woman to be aroused, that the vagina has a lot of nerves. Actually, it's one of the places which has the most nerves, and it's a very sensitive area. And then blood flow also has to go there. Just like in men, where the blood flow flows into the penis, for the woman, also blood flow also goes into the vagina and also into the clitoris. See, we are talking about, and such that now she is now ready for intercourse. So if there are issues, high blood pressure, if there is diabetes, and so on, that will also have an effect on, on the libido. Some other causes, surgery, for example. If you had surgery anywhere, in the breast, in the abdomen, and so on. No woman wants to have intercourse, while in the process of treatment. Smoking. Women today say whatever man can do,
A woman can do better.
a woman can do better. So what we forget is that in the cigarette smoke, there are about 2,000 to 3,000 chemicals. And these chemicals can actually, when they get into the bloodstream, they will cause the vessels to constrict. So there is less blood flowing to where it is supposed to go. So when unavuta sigara yako, you are relaxed, you can do things better than men. But when it comes to that area, you find libido imeteremka. There is what we call body dysmorphia. You are not happy about your body. Women like to be seen as beautiful, as attractive, their shapes, whether it is hourglass or whatever it is, and so on. So when you perceive yourself as not being attractive, then obviously that libido, that desire will also not be there. Medications, some of the medications that we take, antidepressant, for example, and so on, can also lead to that. Alcohol, it is also something else. So there are so many things that come together for this woman to be actually ready to be aroused, and in order for her to really enjoy, the sexual act, as it were, sexual performance.
It is possible that then for someone who is in that space, there could be multiple issues that, so
Absolutely.
and yet we have stigmatized some of these things, and because that is perhaps the reason why people shy away from coming out to even share and express themselves when they are going through these challenges, for what the society will say about them. And yet you could be going through something that is not even for
Related to that.
yeah, it's out of your doing.
I think I can actually share an example.
Yes.
There's some years back when I met a lady, and she shared about her journey, her struggle with with intercourse, and it's like she was wondering why the man is not able to penetrate even if she tries. And when we checked, she had Mullerian agenesis. So her vulva was beyond the vagina, there was nothing, but she didn't know all along. So she had been trying and nothing was working. So until you go and
But she never
see-
had a period.
Yes, she tried, she got once, then it disappeared.
disappeared.
She went through the whole process, but no one, like she had never thought about it as a problem. You see, now that one is not her doing.
Yes.
Until you go to the medical or to you and find what exactly is the problem. Because again, as doctor is saying, you can even have the urge and the desire, and then you prepare. And when you get there, you remember that this man did not buy me a dress that I wanted, and then the muscles will just refuse to open completely.
He didn't buy me chocolate.
Yes,
You're being petty.
Valentine imepita.
Why now?
It's very psychological for us. I can be prepared and you have done everything. Then when you get there, I remember, who is Jerry?
Stop
Then I'll
remembering.
just block. I'll just block. And the muscles will be very tight,
hear
and
you.
it will be even painful. So the libido has everything. For you to go all the way, you can have the desire, you can prepare, and then you have to go all the way so that you can get the orgasm.
So are we saying then, Daktari, that low libido is not necessarily a condition that every time needs an intervention, that there are moments, perhaps out of psychological, exposure to things that are not very comfortable,
Yes.
you could just be, experiencing low libido out of that kind of exposure, and there's nothing wrong with that.
Absolutely. Stress, for example, you are stressed at work. She's stressed at work. The boss is on her case. There are things which have to be done, and reports have to be made. Na wewe sasa ndio umeshika moto and unaguza hivi lakini
Or even the partner, you're stressed about your partner and you are not expressing, because most women will not express what they are going through.
Yeah.
And then when you get there is when you remember, you did, but you're not telling him.
You're not telling him.
And men are not mind readers, so they would not know what he doesn't know.
And that is where the emotional bit really is important for the ladies.
Yes.
The ladies have to feel comfortable.
Yes.
Something else which I think I may want to highlight is about menopause. Menopause is also a very, very big, sort of factor when it comes to libido. When women get to that age, around 40-something, closer to 50.
These I'm finding even younger ones. I'm surprised. I don't know what is happening.
I mean, there are many things that we are doing for them. We are helping them. And then the body starts reducing the amount of estrogen that it's producing. And estrogen is principally produced by the ovaries, and it is what makes women the way they are.
I have a question on behalf of women.
Yes.
There's this myth or this discussion.
Yes.
Personally, I've gone through menopause, so maybe I am a part of those women. There's this discussion that there are some women, when they are going through menopause, their libido goes very high. They just want sex and sex and sex and sex. Is that?
Physiologically, it doesn't make sense. It doesn't work that way because usually, as I said, estrogen is produced by the ovaries, and estrogen is what makes women the way they are. The skin is smoother. They have bigger breasts. They have wider, hips, and they are lower voice, and so on and so forth. It also has an effect in the way you think emotionally. That is what makes you who you are. So immediately when you get to that time where this estrogen now is reducing in the body, all these things start to unravel. Remember that it also affects the vagina. It affects the turgidity of the vagina, the lining of the vagina. So even if you are sweet talking and all these things, now your estrogen is not being produced, that connection between the brain and the vagina may actually not be there. So it will also have an effect on the libido and the sex. So you find that these women, when they're having sex, it's like ni kama mchanga, which is not very good as well.
Could what Caro is also raising be related to a scenario where you find older women who perhaps feel sexually starved and maybe be interpreting that as a high,
that is also possible.
Urge.
That is also possible. And coming to that, then there can also be something else whereby you have a tumor which is producing excess Testosterone. Because testosterone is part of what actually helps women as well, but a small percentage. The bigger percentage is estrogen. So when they have that tumor, it can actually lead to that excessive desire. Of course, we are not talking about other extremes where you have it is called sexual compulsive disorder, where you have this urge that you must have intercourse all the time. That is pathology. That is a disease in its own.
Do we play any active role sometimes unknowingly as men in reducing the the libido in women, in the sense that the experiences we've shared with them are below par in such a way that they don't look forward to any match or rematch?
Yes.
Because
You can see she's saying, we are in trouble. Why did you ask
I
that
was
now?
even tempted to stand up to pass this message because, yes, our men or a man will play a very major role in my libido. Because as we say, we go back to the beginning, that for a woman, it starts with the emotions. It starts with the heart. Unless if you're doing it for business, any other time, it starts from the heart. I want to connect with you.
Yes.
And women, we are created as connecting beings. We connect through eye contact, through conversations, through these things. Then first, I tell you, we need to talk, you run away. Number two, I really want to connect. And for a woman, now I'll tell you, as a sociologist and also as a woman, anytime a woman offers her body, her thoughts, her emotions to this sex, it's like a sacrifice. It's like an offering.
Giving you everything.
Yes, I'm giving you
everything.
Everything. We don't leave anything behind. And so if I'm offering this offering and you are not receiving it in the right way, not the right way, maybe you are not even appreciating.
Yes.
And so I go back to the point of, before you initiate the intercourse, a woman needs three things: attention, affection, and appreciation.
Mambo ni matatu.
That will give me highest of the libido.
Attention, appreciation, affection.
Yes.
3 A's.
Yes.
Okay.
3 A's.
So we are learning just as
we are learning.
For us to be aroused, for the libido for the mechanical process to go on, we need to be touched. We remember we are gentle.
Yes.
We need to be touched. We need to be given affection in a gentle way. We know gentleness. We know cuddling. We know a hug. We know start the process. Don't come and jump. In my mother tongue, we say we are jumping like a bicycle which is stolen. Okay. You're just coming in and jumping. We need to be given that affection.
Yes.
Number two, we need the attention. I want to know I'm the only woman in this world, only, who is beautiful. There is no other woman. There is no other. At that moment, if I'm very uncomfortable about my legs, this is the moment you highlight any other part of my body. Appreciate it.
It covers the others.
Yes, just remind me how beautiful my eyes are. Remind me how good I am and I'm the only one. That is attention. And then appreciate. Give me that chocolate. Give me those flowers. And that is the factor that will bring my libido. Whether it was not there, whether I was not ready, I'll just show up.
So if I bring the bananas, are they acceptable?
Yes. You bring, even walk and find a flower. Just try one day. Just find a flower outside and like, hi, surprise.
This is for you.
This is for you. Oh, she will feel out of this world.
So the foreplay
yes,
plays then a hero.
For us, it is the most important. And so if I'm trying to help you understand and your ego is not allowing you to accept it's me who knows my body. Yes. So if I'm trying to teach you, because again, some women are afraid of going direct to the point. So we use the nonverbal communication. So sometimes I want you, when you're passing, you do this and I'm like, watcha. That one is a trigger. But you don't want to be playful. You want to be serious. You don't want us to talk. You just want to come and just be very masculine with me.
Jump on the bicycle.
The
stolen bicycle.
Jump on the stolen bicycle.
So you are playing a major. You have to allow me. Okay, I tell men, when you want to excite your woman, just look at your baby girl.
Okay.
These young girls. Yes. Your baby girl will come and ask you, am I smart, daddy? And then she'll come and sit on your laps, and your approval is everything she needs. So if you want
So you
to,
never grow.
yes, even an 80,
You're still the small
even
little
when
girl.
you're 85-year-old, you tell her she's beautiful. You tell her something, she will just, and that automatically as a woman turns me on. You don't even have to touch me. Just treat me like a baby girl, a girl toto.
Hey.
There's a switch. So tumejua switch iko wapi?
How many switches are we going to?
Just treat me like a girl toto.
Yes.
And I always remember, and we never lose that baby girl. Because remember, even when we were choosing you as our partner, we were most likely looking for our father. So we need your approval. And verbal. Remember, women, we use our ears. You guys don't want to talk.
We will start talking.
Yes, start talking, start engaging, communicate. We are connective. Maybe you are here, we are even having sexual intercourse, and you're not even looking at my eyes.
Lakini sasa ikiwa taa zimezimwa, how will I look in? I look in the eyes, bwana.
And does the sexual fulfillment that come out of the sexual experience perhaps inform how you will the next phase of libido?
Of course.
Because when we were just catching up on this particular subject, you raised a very crucial aspect that there are women who have never experienced, and Dr. I think you're the one who said that 90% of women have never experienced an orgasm.
And some don't even know
and
what
some
that
don't
is.
even know what an orgasm is. And others have actually, a very tiny percentage, will tell you I've had multiple orgasms at the same time. Na wanakuambia orgasm sio ile ya ndani, kuna ingine ya nje, kuna ingine ya ndani.
Ziko aina nne.
Hai, unasikia? Aina nne. Sisi tunajua moja tu. So again, I think that comes back to what you're talking about, that preparation phase, that emotional bit, most of the time it is not there. And then you see, when we get there, we think we are doing the right thing by rubbing or whatever, and wengine wanakaa tu they just be lying there. Ukimaliza niambie, ama nifunike. And, it means that the boy child has a problem.
No, the boy child doesn't have a problem. The boy child is misguided.
Misguided.
Okay.
Maybe that is better.
And also the boy child is not willing to learn the physiology of a woman. As doctor has said, the outer, the vagina, is more sensitive than the inside. But the physiological of a man wants the inside more than the outside.
Okay. The woman who is going through this and they have had all these details you've given, that perhaps they are seeing themselves in everything you're saying. Where do they start? Daktari, you handle a lot of cases, and you are the expert together with Caro here. Mtu anaanzia wapi? When I've now, nimekubali, I have a challenge when it comes to libido as a woman. So what do I do next? Who do I see first?
I think the first thing is to take a history. Try to understand what the problem is. What is the problem? So is the problem the pain? What is the reason of the pain? Is the reason because of endometriosis? Is it because of polycystic ovaries? Is it because, the libido, is it because of polycystic ovaries? Have you had surgeries? Are you taking medications? How is your home environment? Do you talk with do you have a talk? And sometimes when you immediately ask, how is your home environment? It's like opening a tap. And I say, my husband is this. My husband comes home, late. I discovered my husband is having an affair, Immediately, all these things now start tumbling out. So the first thing is to, what Caro was saying, listen. Ask and listen. So once we have found out what the issue is, if the issue is medical, obviously we can deal with the medic side of things. If it's menopause, there are things that we can use. If it is, whatever is medical, we can deal with medically. There are medications which we can give, which can actually up the libido. And then later on, she can be able to enjoy her sexual life without any problem. If it is psychological, then I think Caro is here and other people who can now come in whether it is counseling which is needed. And counseling is a big challenge for men, Africans especially. We think, how do I go and start talking about my, yani, naenda tu kujifungua ati kwa in front of somebody. So that is something else where we need to so we need to work together. We need to work with the psychologists, we need to work with the doctors. If there are any other specialties which are needed, we also need to work with them. Because remember, actually, women can enjoy sexual life until even the 70s without any problems. Yeah, without any problems at all. In the West, for example, in Europe, when you talk about menopause, it's like just one of those things that happens. There are so many products that they can be able to use, and they enjoy their sex until late in life. So I think we can do the same here. The only thing is that we need to start talking.
Yes.
And I think that is why this is a beautiful place to start from.
Oh my goodness. I actually hope that we will get a chance to talk about the orgasm, because let me shock you.
I'm looking forward to that.
Shock you. A woman's orgasm lasts longer and it is deeper than a man's orgasm. The person who enjoys sex more is the woman.
Okay.
Yes. Now that's a woman talking.
Yeah.
A woman who. So for a woman to go through this process and to be able to work on her libido, other than what Dr. has said, one thing I've learned either through my experience and through all the clients that I've been meeting, the first stage is self-love, self-care and self-awareness. You need to know to love yourself, accept if I'm this curvaceous, I cannot be petite even if I like. So I will accept my body, because most women don't even want to have intercourse because they hate their bodies, because they are not comfortable with their bodies. And so even the men who want to attack a woman, they will always attack her self-esteem by telling her she's not beautiful, because every girl wants to be told she's beautiful. But if the self-esteem comes from within, it will be a better thing. Self-awareness. If you are aware, all of us have different sensitive parts. You need to be aware of what you like, how do you like it, what do you need. Like, for example, a woman who is, let's say, financially stable might not need a man's finances. However, she needs a man's ear and the attention and affection. That's just an example. So when you know what you need, because a man is meant to protect, provide, and procreate. So this provision is not necessarily money. However, we have made it about money. That is, at that point, we have made sex transactional.
Yes.
So for this woman, when you're aware and yourself, you appreciate yourself, no one should put you down. When you are not obese, also because obesity will affect your libido. When you are not desperate to go and get any medication and all these things, then when you have the right psychological setup, there is another thing that affects us as women, the environment. There are women who cannot have sexual intercourse in light
during the day.
Others outside, others cannot do because maybe of their upbringing, and that comfortability. They need to be comfortable with the partner, but also comfortable with the environment. Yes.
There's clearly so much about this talk. But Dr. Ari, any final words on this, and then we wrap it up?
I think libido also depends on the fantasies.
Oh, yes.
Okay.
Also, but we'll not go, maybe we'll go there another day. We'll go there another day. So basically what I would say is that this is a problem which is very common, but even if it is a problem, it can be addressed and it can be taken care of. And sex is basically for man, and that is why God created man and woman. And when he told them to go out and be fruitful and multiply, essentially what he told them is that to go and have sex, because you don't have children, by cross-pollination,
looking at each other.
or by looking at each other. Even though, of course, the Bible doesn't say that directly. So this is something that anybody who has a challenge can be addressed and they can be helped. So they shouldn't, keep it to themselves, thinking that this is their own problem.
And of course, you've had it. So much to talk about in so little time. Let us know what aspects of your reproductive health you would want us to address and talk about in our subsequent episodes. We're very glad that you could find time to join us on this series, Reproductive Health. We hope to see you again next time. God bless you.